retaining the crown. Okay, the second type is Axiom XP or PX. The PX is used mainly for immediate implant placement. Whenever you extract and place the implant. So you can extract and use this PX just only if you have a socket, fresh socket after extraction. And can be used for thank you. Yeah, it can be used for soft bone. And the most important criteria or property is the position of the threads. They are characteristic in a way engaging the socket after extraction. As we said, that should be used with all types of bone except the D1, the hard bone. They have the same connection of 2.7 that help you to get the connection inside the implant. And one of the characteristic of this implant is the double-threaded type of topography that help engaging the socket. Okay, the third type is the Axiom 2.8, which is the narrow type of implant and used in very narrow or limited spaces. 2.8 millimeter, and then you can place the connection, which is 2.0. That help you to place the implant in very narrow spaces to accommodate implant and restore small spaces. For the abutment part, we have a very nice thing that we place it with the friction and engaging the inside of the implant, and by the use of safe lock that will help in retaining the abutment in a very easy way to retain and reduce the leak between the abutment and the implant. And the size of the implant, as we say, the size of the abutment is 2.0. Okay. We have different surfaces that use and facilitate and help the or promote the bone growth. We have here what they call it PCP, biphasic calcium phosphate, type on the top of type 5 titanium, and that will help bone formation around the implants. The surface is very active in a way, promote bone formation, as they mentioned, and they did a type of treatment which is sandblasting, soft acid etching, and then later on rinsing. So all these will help facilitate the treatment of the surface to make it more retentive for bone formation later on. Okay, this is the connection that we said. The good thing that it's internal part, so the anchorage from the internal part of the implant, and that will stabilize and keep the rigidity of the neck of the implant. And in the oblique type of forces, still they said that up to 200 newtons still withstand the forces of high mastications or oblique forces. 200 newtons is very high compared whatever we are going to use, biting forces or eating forces. The kit is very easy to use, color coded, and then you can just follow the lines or colors, and then you can drill your side and place your implant. If you allow me, Dr. Abdurrahim, do you think you can give a brief how much that will cost for the implant? What's the cost of the implant?
Since we are launching this product since the beginning of 2014, we have still our special offer of 1,200 riyal, 1,200 riyal for both implant for both implant and abutment, 1,200 riyal. Of course, if you contract with us for 100 implants or more, then will be some special offers also. This is honestly, although last December Anthogyr increased the prices for us, we decided not to increase the prices in 2015. So we try about this.
This is the whole implant, abutment, and picture?
Implant and abutment.
Oh, the whole.
Yes.
The whole kit,
Yes. 1,200, 1,200. Okay? This is still the special offer of the beginning, but if you don't buy quickly, prices will increase.
But then also you can help them for education. Huh?
Yeah.
If you get the implants, it will be free. That will be free part of the implant.
We will lend you the implants, the surgical kit if you have a small purchase, but if you buy a bigger purchase, it's yours. Or if you reach a bigger purchase, it's yours. And we will include also some training. It depends, you know. There are people who are telling me, I want to buy 1,000, but I will pay one by one. That's of course not easy, okay? Remember that we are buying in advance payment. If I buy from Anthogyr, I have to pay it in advance. إلا تحت التصريف فيه بس كمان يعني تتجاوبوا معانا يعني إن شاء الله يعني لحد ما مش تعملوا زي بعض الناس. يلا خير. Training, Anthogyr provides training 4 times a year, which we have to cover the costs, of course, but they provide the training. But travel expenses we have to, and accommodation we have to cover it. So this is also included if you contract with us a bigger purchase.
So it's free training.
Yeah.
Okay. Concern the, we go quickly. You know, everyone is hungry. This is the kit. We have different sizes with different color coding. And if you can see, majority of the systems now, they're following the color coding. The color coding is very easy and illustrative and help the surgeon and the prosthodontics or the restorative dentist to be guided by colors. Very easy and very illustrative. So this will be the same issue over here. As you can see, different sizes, different colors, and then you just follow the drills. And very small and practical type of kit. You have the initial drills, or what they call it bone marking drills. Then initial drills, which is the violet drills, which can help you to guide and make your position. And then you have what they call the guiding pins, to allocate and realign yourself to whenever you place the implant or beginning placing the implant. If you have multiple implants, you can use the parallel indicators that will help you to make or align your implants. And then you drill your side, prepare the osteotome or the side you will place the implant, and then you have the implant placement and tightening. Very easy, and then you have the ratchet there and the screwdrivers. So this is the kit. The drill is very efficient, as they mentioned. Peak color drill. They have stoppers. You know these stoppers. Many people, they like to use the stoppers. These stoppers very nice to stop the drilling to certain depth. They come in different sleeves, length, and for different drills, just to help you controlling the depth of the drilling. Okay? And subsequently, you have to use different sizes of drills, depends on the size or equivalent to the size of the implant that you're going to place. These are the implants, that the variety of sizes that they have. They have